All right, today we're tackling one of the biggest health challenges of our time, chronic conditions. We're going to go on a journey from the huge global healthcare systems designed to manage these issues, all the way down to the single most important person in the whole equation, you, the individual. Okay, let's get into it. Let's just start with a number, 74%. That is the percentage of all global deaths caused by chronic, non-communicable diseases. It's an absolutely staggering figure, and it completely reframes what we think of as a global health crisis. And that really makes you wonder, right? We tend to think of pandemics as something you can catch, something that spreads. But what if the single biggest threat to our health is something that builds over a lifetime, isn't passed from person to person, and needs constant management? And this brings us right to our first section, the silent pandemic. Honestly, it's the perfect way to describe it. It's a crisis on a global scale, but it plays out in millions of deeply personal challenges every single day. So what exactly are we talking about? Well, a chronic condition is basically any health issue that's persistent. We're talking more than 6 months and needs ongoing care. You got to think of it as a marathon, not a sprint when it comes to your health. And the human cost here is just immense. 41 million, that's how many people die every year from these diseases. But here's the part that really gets me. 17 million of those deaths are considered premature. That's people dying before they even hit 70. And look, this isn't about just one disease. Not at all. This term covers a massive range of conditions. You've got the big ones like heart disease, cancer, and diabetes, but also the huge, often invisible burden of mental health conditions and things like arthritis. And this is so important to understand. This is not just a physical battle, not even close. Living with a chronic condition can seep into every corner of your life, your job, your independence, and your mental health. It really affects a person's entire well-being. So how in the world do you tackle a problem this big? Well, you need a plan, a blueprint. Let's move on and see how healthcare systems are trying to design better ways to actually support people.
The official term for this kind of blueprint is a model of care. It's essentially a game plan. It's all about figuring out how to get the right care from the right people to the right patient at exactly the right time. It's about being proactive instead of just reactive.
Now, one of the most famous and influential of these blueprints is something called the chronic care model, or just the CCM. It came about in the late 90s, and it was a total game changer because it basically said, hey, to get better outcomes, the entire system has to change. The CCM is built on 6 interconnected parts. The core idea is that you can't just treat the patient in a vacuum. You have to transform the whole ecosystem around them. It's everything from empowering the patient through self-management support to redesigning how care is delivered and connecting it all to community resources. It's a full 360-degree approach. But, a great blueprint isn't the whole story. In the real world, even well-funded systems can really struggle with things like fragmented care, where your different doctors don't talk to each other, or huge differences in access to care. It just shows that there can be a massive gap between the perfect plan and everyday reality for patients. And this brings us to a really critical shift in thinking. The system is vital, absolutely, but it can't do everything. The most powerful person in managing a chronic condition is the person who has it. So this section is all about that move towards self-management. So chronic disease self-management, or CDSM, is pretty much what it sounds like. It's about you taking an active, informed role in your own health. But pay attention to that last part, in partnership with their healthcare team. This is not about going it alone. And here's the secret sauce. You can give someone all the information in the world, right? A stack of pamphlets. But if they don't believe they can actually use that information to make a difference, it's pretty much useless. The real key here isn't just knowledge, it's confidence. In psychology, this confidence actually has a name. Self-efficacy. It's your own personal belief that you have what it takes to get something done, whether that's monitoring your blood sugar, sticking to an exercise plan, or just speaking up for yourself at a doctor's appointment. The psychologist who really pioneered this idea, Albert Bandura, he put it perfectly. He defined it as the belief in how well one can execute courses of action required to deal with prospective situations. So it's not about having the skills. It's about believing you can use them when it really counts. So, if self-efficacy is the goal, how do you actually build it? Well, it turns out there are structured programs designed to do exactly that. Let's look at 2 different ways to get there. Here we can see two of the leading approaches. On one hand, you have the LORIG model from Stanford. It's all about group workshops, led by peers, other people with similar conditions. The focus is on building confidence and skills together. Then you have the Flinders model from Australia, a totally different vibe. It's one-on-one with a clinician, and it's all about creating a super personalized care plan. Both work. They just offer different toolkits for empowerment. Okay, so we've established that the individual is in the driver's seat. But every great driver needs an amazing pit crew, right? Let's talk about the team and the absolutely vital role support plays in all of this.
In this whole ecosystem of care, nurses are so often the linchpin. Seriously, they're the ones who connect the dots, who bridge the gaps between different doctors, and who provide that consistent support that patients need to build up their confidence and stay on track.
I mean, just think of all the different hats a nurse wears. They're an educator, breaking down complex info. They're a coach, helping you build that crucial self-efficacy. They're a care coordinator, helping you navigate a confusing system. And maybe most importantly, they're your advocate, fighting for what you need. So, in the end, it all comes together right here. The most effective chronic care isn't just about having a great system, and it isn't just about having a motivated individual. It is a true, active partnership between an empowered person and a supportive, coordinated healthcare team. Which leaves us with one final thought to chew on. We always say that health is deeply personal. But after everything we've just looked at, from health systems to community support to the role of a nurse, the real question is, should it ever be a solo journey?